Hello TVHR viewers, I am Sanjeev Pandya welcoming you to the another episode of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. Your happiness is a reflection of your good health. So for your good health, we bring you this show. The importance and benefits of Ayurveda and the Panchkarma that we discuss in this show with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center USA. Ambika ji, once again, welcome to the show.
Hello, thank you Sanjeev.
Ji, namaskar.
How are you?
Bilkul, I am well.
Namaskar to everybody who is viewing the show.
So, Aditi, viewers who watch our show, obviously they send in their questions and they ask for, guidance and suggestions when it comes to Ayurveda. And one such request has come in for us to talk in this episode is anal fissure.
Oh.
What is this anal fissure and is it really that serious?
It's very serious and it's so painful.
Really?
Anal fissure means, in the anal means gudam in our Ayurveda.
Correct.
At the last of this, where to defecate.
Okay. Rectum.
So,
that's
that means outside of the rectum.
Okay.
So like a grape-like things will come. Otherwise, it will like a projections will be there under the skin, like a blisters it is, and it is so painful. And and it can be a tear over there in the anorectal region. Okay, in the some it will be there. There can be swelling. There can even because the passage is totally blocked actually. Because of the swelling, it doesn't come out. The patient cannot sit, and the patient cannot walk. He will be holding the see. This everybody suffers once in life.
Achha.
Because if you try for a long time, if you do anything like that, you suffer a lot.
Really?
Yeah.
So it is a significant amount of pain the person would have on the back.
Like dying pain.
Oh my God.
It's not significant. It is like dying pain.
Wow.
Yeah,
so what exactly causes this anal fissure?
Causes are like one bada sa lamba list.
Really?
Okay. See, this is seen even in the newborn children. If they don't take, see, in Ayurveda we call it with the gravity, it has to come down whatever we eat. So the like Vayu also, if it doesn't come down, so they get like a very constipated, like very small children. It's very common.
Achha.
Like the first year they have this fissure pura, they say it becomes like a grape, all the area like that, and it's so painful. The child doesn't even allow you to touch that area. They cry, cry like crazily. Yeah, and so that is the first year. Okay, and the children, because if you are having a very bad constipation, the stools are very hard. Okay, we go and it will be like straining a lot to pass the stool. So that really creates a lot of injury to the anal canal because there is no hair or anything inside, So that area is like, because the mucosa becomes like a very soft, so it can get cut. So afterwards, that even after passing stool also it will be painful. Before passing also it is painful, and even after everything also the pain will sometimes stay the whole day. You cannot even stand, even 1 second you cannot stand. Yeah, it's very painful.
Does it lead to excessive bleeding? And
that is if the cut is there.
Okay.
Yeah, sometimes excessive bleeding will be there. Sometimes, like a watery stuff can come down, that oozing will be there, and very painful it is.
So in the language of Ayurveda, where we know kapha, vata and pitta,
yeah.
Do you think this anal fissure is because of excessive pitta?
Yeah. Excessive pitta is also there, excessive vata is also there, even some days excessive kapha is also there.
So even
all these three are not balanced.
Even little kid can also get this?
Very little, like a newborn children, like 3 days, 4 days, then they have. That's why you can see that they use a lot of suppositories for the children, that's why, yeah.
All right, so anal fissure is the topic of the day, and that's what we are discussing here with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center USA. So now let's say we know the symptoms. The number one symptom is this unbelievable amount of pain, right?
Yeah.
What causes it really? Root cause of this?
Root cause is because hard constipation or sometimes diarrhea. Sometimes very bad diarrhea, because
So
if you're continuously having diarrhea means that area, become very sore.
Okay.
That is vata. Okay. So that area become very sore, and it is very difficult to, because it will be like, see, it is not a normal bowel movement. So that area becomes very sore. So that is very painful.
So it could be either one. Either it's a diarrhea or constipation.
Very bad constipation
Constipation constipation se bhi ho
very
sakta hai, ya to
constipation
diarrhea
is
se bhi
very
ho
hard
sakta hai.
stools, no?
हाँ.
So that's why, like some days, they had to remove with the gloves, because even with the enema it doesn't come out. And manual evacuation is needed in certain cases, especially in old age. And some anal diseases also, like a Crohn's disease, and some cancer of the, because there are some diseases also in this.
I remember you had mentioned that a little while ago that this is very, very common, and almost everybody experiences this kind of pain.
Yeah, some people will experience like a half an hour,
Acha.
like a 1 hour.
Correct.
Sometimes, before defecation they may not, before passing stool they may not feel it. Sometimes after passing urine, like a stool, it is like a dead body.
So in a
So
different
painful.
stage of life, people
Everything,
will experience this.
And
kind of pain.
this I have seen, especially in ladies, like after the first baby delivery, like, so with the episiotomy, some perineal tear will be there, and if the episiotomy is not sutured properly, if like stool softness are not given properly, and these things, then, and if the food is not good, if they take a lot of other, like very hard things.
Correct.
So this all, that's why at that time we tell them not to eat such things, and we give the diet in a very good way. Yeah.
Okay. And also individual who drive a lot.
Yeah,
I think this is quite a
If
bit
it's-
common in those individuals
Yes.
also, right?
If you sit for a long time.
Acha.
Yeah. And this is very common in those
So it doesn't
people
matter
actually.
whether you're driving or maybe let's say
No.
you're working and
Sitting
sitting
in
on
the
your chair, in
chair
your
for a
office.
long time. So
Correct.
you are prone for the fissure. So that's why I told, like in your life, see here actually it is very common, like 6 to, like out of the 10 people you can at least get one person with a fissure. It's very common now. Yeah.
All right, so with that note, we're going to take a break, and when we come back, we'll continue our conversation on anal fissure. That is the topic of the day in this Ayurveda Mantra show. Please don't go anywhere. Welcome back to the second segment of the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center, USA. Today's topic is anal fissure. In case if you know someone who's experiencing this, who's going through this unbelievable amount of pain, which could lead to rectal bleeding and whatnot, and that's what we are discussing, anal fissure. Earlier, Ambikaji told us what anal fissure is and then how common that it is really becoming among many individuals. So continuing the conversation on anal fissure, Ambikaji, this can lead to piles and hemorrhoids and everything?
Yeah, hemorrhoids. See, actually, to understand whether you have fissure or, like it is a piles, hemorrhoids. So you have to see if fissure means, it will be like a cut. Okay. Hemorrhoid means some people will get a protrusion. There are like certain positions accordingly. Okay. Maybe like for a long time, if you have a like a hemorrhoid, that projection will be there. Like hanging things will be there.
Gotcha.
Like a skin, it will be hanging over there. So that also, like, and not only that, people will, especially in the fissure, they will explain you how they feel it. It will be like so much of glass pieces are kept in my anus. This is what they say. And it is so painful. When there is glass pieces kept in the anus, how will you sit down?
Correct, absolutely.
Okay. So, and it will be bleeding like hell.
And that's a treatment.
And the pain will be like, like a sciatica pain.
Unbearable.
From the unbearable pain, neither they can stand nor they can sit anywhere. And they get so irritated and they become so depressed. Yeah. And it starts for a long time and bleeding will be horrible. they cannot eat any spice, nothing they can eat. They cannot lie down because the back will be hurting.
To diagnose this anal fissure, what is the most early sign that you can tell our viewers, so that way at least they can start thinking about prevention?
Yeah, when you have see, these people always get a acid reflux, you understand? And their digestion will be very, very less. Okay. This is one of the important things. And getting constipation. Constipation has to be cleared. Drink a lot of water and eat a lot of fiber food. That is more important.
Acid reflux and a constipation.
Yeah.
These are two that you suggest are the most common
things. Okay. And like experiencing little pain. Sometimes they always misunderstand, I have a back pain, because I get a lot of cases like that. So back pain. So when we do the examination, so it may not be a bone problem. You understand?
And some people think also maybe after eating some spicy food, they think maybe it's because of spicy food.
Usage of so much of chilies, chili powder, too much of chili, and so much of like chicken.
So spicy food khane se bhi ye ho sakta hai. All right. So anal fissure is the topic of the day. Ambika ji, I want to know what exactly is the difference between hemorrhoids and the anal fissure, because maybe some of our viewers, they might be confusing hemorrhoids and anal fissure. So what exactly is the difference between those two?
Hemorrhoid protrusion will be there.
Ji.
And that anal, that skin will come out a lot.
Achha.
Okay. Then you have to push it inside.
Correct.
Okay. And certain areas, like only one place it will be hanging.
Ji.
But fissure is never like that.
Achha.
You cannot even do the rectal examination on those people, because it is all swollen. It is totally swollen, and it's very difficult to even it will be totally inflamed, very bad, because they cannot even wash it properly.
So what kind of treatment did they offer in allopathy? Surgery or?
They do surgery, they remove the sphincter.
Oh my God.
But afterwards so many issues comes with that, because they have no control. Actually it is a liver related issue, and sometimes it can be with the cancer also. Any other diseases which can be a predominating symptom also. Achha. Like any tumor formation in the in between area, like obstruction. Okay, all these things. Yeah.
Okay, and talk about surgery. One of our viewers in New York watching our show on TV Asia has sent us a question that this person had surgery done for anal fissure, but obviously not happy with the surgery because surgery hasn't responded very well. Person is still having unbelievable amount of pain. Wants to know, can Ayurveda cure this anal fissure?
Definitely. Thanks a lot for the question. Actually, they remove the sphincter, and mostly we see that because these people get into a diarrhea type, because the sphincter is already removed. Okay, and it will even see. I already told you that because of this is one of the reasons for the anal fissure. So you can come to us, take like our number. You can come and see us so that we can take care of you. And we have very good treatments and medicines in Ayurveda.
Absolutely.
And your diet also.
Oh yeah, that's important. Anyway, you can make a note of this email ID. info@santigramusa.com is the email ID. Send in your questions, and Ambika ji in this show will definitely answer your question. With that note, we're going to take a break. We will be right back after this messages to give you more information on anal fissure. It's all coming up, so please don't you go anywhere. Welcome back to the third segment of the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. SantiGramUSA.com is their website for you to check out all the details on Ayurveda that you need to. Also check out their locations throughout USA, and if there is a location near you, you should definitely go to that location and see what are the options they have for you when it comes to Ayurveda, Panchkarma, and the authentic herbal treatment, authentic Kerala herbal treatment. That's what Santigram Kerala Ayurveda Wellness Center offers for you here in the USA. Let's continue our show, and today's topic is anal fissure, and we're talking more on anal fissure. Now, this anal fissure, now we know that unbelievable amount of pain and uncomfortness, and because of constipation or also diarrhea can lead to this thing, right? Surgery is not always a good option. Now we know that too also. Now let's bring that into Ayurveda. How do you diagnose that once a person comes to you and through your Nadi Pariksha, how do you diagnose that?
Whether which is, where the fellow is suffering, why he is suffering.
Correct.
Okay, some days it will be just vata related, dryness everywhere in the body. Okay, so all the intestines and like all those things, and any obstruction is there, like stricter formations will be there. So whether it is related to that, so with the basti and all, they really come out very, very nicely.
Achha.
Then whether with the diet, so we have to treat them for the cause. Why they are like this, what made them, and if if they are driving for a long time, and if that is the way they have to live, that is the they have to live like that, means that it will be very difficult. We get a lot of taxi drivers and all those people.
Achha, so you have a you do have a lot of patients who are taxi drivers who drive a lot.
They cannot sit, they cannot even lift their leg, they come and cry in front of you.
Oh my
very
God.
pitiful.
Sad, very sad.
But we take care in a long way, and Panchakarma treatments are there, so we give Virachanam for them. So like Snehapanam. So with that, it helped them a lot, and there will be some associated ailments also along with that. So we do treat for the cause.
Okay.
Yeah.
So now we know that sitting on your chair behind the desk, or person who is driving too much for a living, let's say. Now we know that too much sitting is not good during the day. That's number one thing.
And another thing is, Sanjeev, alcoholism.
Okay.
Too much of alcoholism.
Oh,
because
too much
it is
alcohol
through
can
the
lead
with
to
the
this?
it adds misery to this actually. This is also one of the root causes. They eat a lot, and so many painkillers are used.
Okay.
Unnecessarily using, little pain here, there, they take a lot of painkillers. So this all lead to very chronic constipation.
So even though everybody's body is different and everyone's body reacts differently to different medications,
yes,
right?
Yes.
So you're still saying that painkillers and the side effects of painkillers,
so many painkillers,
that even too much of alcohol can cause this anal fissure?
Yeah, even in allopathy, the doctors will tell them not to take so much of painkillers. See, this has to be used for a cause, not like a snack. So many people use like that.
Achha.
So everything, whatever you eat, it is absorbed by the liver only. Yeah,
absolutely.
So this all the troubles what you get from the liver.
Okay.
Yeah.
Now when it comes to Ayurveda, obviously anal fissure is not one of those kind of easy disease to take care of.
Yeah,
it,
we
right?
can take care.
Panchkarma.
But it will be like a chronic. So we do the detoxification, and afterwards they are much better. And we give them the lifestyle, how they have to live.
Very controlled lifestyle, controlled diet.
It's not a controlled only with so much of fiber, fiber and so much water.
Achha.
Yeah.
Okay.
And Viruttahara, not to eat fish with yogurt, like certain things, according to their need, we will tell them.
And then herbal medicine.
Herbal medications are there.
Okay.
And what they can do at home. And there, so after few days, that you can see that how nicely they are.
Okay.
Yeah, where they were such an inactive rectum become active. Yeah.
Interesting.
Yeah.
So, well, there you go, viewers. Now you know that anal fissure can be treated through Ayurveda, and it can be taken care. That's what we find out from Dr. Ambika Nair. With that note, let's go to a question. One of our viewers have sent in a question, Ambika ji, and this question, I would say, could be common, I guess, and could be related to many of our viewers out there. It has to do with infertility. And this particular viewer is saying that they have tried IVF, IUI treatments, but so far no luck. And they really want to know that can Ayurveda cure infertility?
Yeah. See, it is not the cure, like in this one.
Solution.
So we have to find the solution for that.
Exactly.
So when you come, I will see that whether, anyway, thanks a lot for the question. And I do treat a lot of infertility. And I was doing since so many years, almost 36 years now. Okay, so I have a lot of, I should say that, I should not say sometimes, like 98% is successful.
98%
Is
success
successful.
ratio is
Okay.
that amazing.
So, and I treat all chronic cases like IVF and failures and IUI failures. So, if you are willing, you can call our, like info@shantigramUSA.com.
Right.
Send me your all details, or you can call and make an appointment, and I can do the best for you.
All right, so that's the key thing where this latest medical science fails. That's when Ayurveda can really help.
So
and
many cases we are doing.
And we've been saying that this is a very, very ancient tradition. Ayurveda is.
These are very unique treatments. Are there
Yes,
for
it
that.
is absolutely, and for thousands of years,
Yes.
it's been curing many individuals,
Yeah.
throughout the world. So it's good to know that infertility can also be solved
Taken
through
care.
Ayurveda.
Yeah. And this is the luck too. You understand? No?
Yeah.
We can make miracles with his help. Yeah.
And like you always say that how much you want to help me and I'll help you further, right? So you help me a little bit and then I'll make sure.
I will try to help you more.
But 98% success ratio in treating infertility is a very, very,
very
good
amazing
sign.
actually, I should say. Even I myself feel.
Correct.
Yeah.
Good, good. Okay, with that note, Amika ji, in the end, mantra of the day.
Mantra for the anal fissure I will tell now.
Okay, please.
Because actually, please drink a lot of water, and when you go to bed, take little warm water, put a pinch of salt, common salt, pinch of salt, not 1 tablespoon of salt, okay, and so that you get a good motion always. Okay.
Pinch of salt in the water before
With the
going
warm
to
water
bed?
before going to, they should drink it.
Before going to
Yeah,
bed.
if they keep it aside, it will not happen. They should
And it should be warm water.
Well, yeah, lukewarm water.
Lukewarm
it should be like that.
Oh, that's
And eat a lot of fiber, rich food. And like a snake guard and all, it's very good actually. And stop using these red chilies a lot, red chili powder. Okay,
yes.
that is not that great for you. If you have, and spices has to be brought down. Yeah.
But I'm sure there must be some viewers who don't want to give up on their taste. So
No.
So they will
Taste
follow.
and all, it is like, like you die, then what taste? Once you become all right, then we can slowly start it.
Okay.
Yeah.
That's interesting to know. Thank you, Ambika ji, for that tip. That's a wonderful, wonderful tip. Warm water before going to the bed with a pinch of salt in it. Very nice. Until we meet again at the same place, same time, right here on your favorite channel for the Ayurveda Mantra Show. You please take care and keep a good health and wishing you all a very vibrant health ahead. I'm Sanjeev Pandya, thanking you all for watching the show.
Thank you very much for watching the show. Stay healthy.
That's right. And please do take care of yourself. So long.